You're going to end up with some bottlenecks. If you just start throwing doctors at the problem and exam lanes at the problem, we've got surgical scheduling needs to be taken care of, the additional diagnostic equipment.
My name's Collin Hart.
And I'm VanderWeele with Eckert Wordell. Today we'll cover what you should be thinking about when designing healthcare facilities.
In this video, we'll talk about designing for scale and considerations you can take when you're planning for future growth. So Jared, what should we know about designing your facility for future expansion?
Sure, great question, and one we should always keep in mind when we start, because intuitively, the space is going to need to put more patients through it, and we want the opportunity to expand that. But there's certain things you want to stay consistent so that you don't have to disrupt and undo what you've already done.
Okay.
So some common things that we see our clients doing is as they grow, they look for opportunities to move their admin suite off-site. So billings, phone center,
Sure.
The CEO, whomever is running the practice, you pull them off-site. And so with that in mind, how can we set that group up in the initial design so that exam space can grow into it?
So when you're designing for the future in mind, you might set up your administrative space so that in the future it's planned to be revenue generating space effectively.
Well said.
Exam lanes where you can put patients through, right?
Exactly right.
Right.
Yep. And another thing to think about if that's the ultimate goal is what else comes along with that, because you're going to end up with some bottlenecks. If you just start throwing doctors at the problem and exam lanes at the problem, we've got surgical scheduling needs to be taken care of, the additional diagnostic equipment. And then did we establish a reception room that was large enough in the first place to handle it? Because we don't want to come back and disrupt that.
Right. Now, if we have more patients, we probably have more cars, which means we need more
parking.
Right.
Parking.
So that's a tough one to solve for. So on the front end, a practice probably has to think about, hey, we need a larger parcel than just what'll accommodate our current building size. Is that right?
Exactly right. And you've seen medical offices can go into all sorts of different settings, and they don't always accommodate the medical office scale parking. We have a much higher parking ratio per square foot on medical offices versus a lot of other just general office types.
Right. So Jared, in a prior video, we talked about how codes change in surgery centers. So if you're upgrading a facility and expanding your ASC, it's going to be pretty costly if the codes have changed and you need to upgrade to meet those codes. So one thing that I've seen is, practices will add kind of a space for a third OR or fourth OR, but not necessarily build it out. So is that a strategy that people can use planning for growth?
Yes, having a shelled out space to lean into, absolutely. What comes along with that is pre-post-op bays and some of the support nursing staff space on day one. You could do that in phases. You can have that future third, future fourth, as long as you also know how to expand those pre-post-op bays, because they're going to stack up on you pretty quick.
Yeah, makes sense. Well, those are some really good considerations. Again, this is a long-term kind of project. We have to think about the future, not a year from now, not 5 years from now, but 10 or 20 years from now. And so hopefully the content from our discussion will help guide those situations.
Well said.
Excellent.